Everybody good? Everybody can hear and see? Just the last couple here. I'm gonna go over here for a second, then I'll get out of your way. Where do you want me, so I'm not in the
I just
way?
wanted to make sure my phone had the.
Okay.
I don't need it for you.
Welcome. Thank you guys for coming. It's going to be a great seminar with Dr. Corey Paradine of Cleveland Equine. And I'd like to introduce my new rep, my awesome rep from Marielle Boehringer Ingelheim, Annie. And she helped me put this all together, so hopefully you guys all will enjoy it. We had a seminar last night. Like I said, it was great. I'm sure this one is going to be just as great as that one because we've done this before, and she is so knowledgeable, and I'm sure you all use Cleveland Equine. If not, maybe you should, I don't know. But anyways, let's get started, and please feel free, ask questions, and enjoy.
Is my microphone on just for the camera, or is it live? Okay, I didn't know if we needed it for you guys. If you can't hear me, let me know. I'll try and talk louder. Like she said, ask questions. Sometimes I might make you wait because it might be something I'm going to address later, but don't hesitate. Happy to, chime in and help clear some things up. Hopefully this will also clear some things up for people. But there's a lot of information out there, and there's some mixed information out there too that might not be entirely accurate. So hopefully we can help clear some things up. So talking about equine gastric ulcers today. I just want to clarify we're talking about the stomach. So people want to talk about hindgut ulcers. We're not talking about that today. I'm happy to entertain some questions about that at the end, but we are talking purely just the stomach today. So I want to start with some anatomy, just so we all have an idea of what we're talking about. So this is a picture of essentially a dilated stomach. The top part, you have what we call the squamous mucosa or the non-glandular mucosa. The bottom half is the glandular mucosa. Pretty sharp distinction between the two, and that's normal. Some people, when we start doing scopes, you come in, you see the top part of the stomach, it's a nice, pretty light pink, and then we come down just a little bit and you can start to see the glandular mucosa, and that's a dark pink. And some people are like, oh no, is that like just a really big, massive ulcer? It's not. It's a normal color change, different cell types. Then we have kind of towards the outflow, the antrum, right before the pylorus. The pylorus is the opening to the small intestine. Common area for ulcers, so when we scope, really important that we see all of the stomach because they can have ulcers in any part. There's no relation to if they have ulcers at the top, they're more likely or less likely to have them at the bottom. Just got to see it all. So again, looking at normal stomach, I just want to put some pictures of what normal is, actually looking at a stomach. So here is a picture of your non-glandular mucosa, and then the distinction, that line in between the two, is called the margo plicatus, and then the glandular mucosa underneath. This is back looking at the opening of the esophagus as the scope comes in, but again, you can see the difference, the marked difference between the two different cell types. And then these two pictures are down at the pylorus. So again, different look to it, but this is all normal. We'll get into what is abnormal later. So what causes ulcers? And essentially a lot, and to an extent, we also don't know. So management absolutely plays a role. Horses are made to graze near continuously. We don't do that with horses. Most horses are not outside 24/7. They don't have grass in front of them. They're not walking a little bit and grazing near all day. So stalling horses, feeding them meals rather than continuous feeding absolutely can play a role. Horses don't have a gallbladder the way people do. So they are constantly secreting this acid and secreting these digestive enzymes into their stomach. And so if there's not food there, the acid's just sloshing around. So management, absolutely. And then, just being in the stall in general, you know, horses are kind of made to be outside. And, you know, for good or bad, we don't really treat them how they developed over the years. NSAIDs, so medications can contribute. NSAIDs being bute, banamine, Equiox. Those drugs can play a role in ulcer development. The way they work, they can inhibit some normal healing mechanisms that the stomach has. And then stress, you know, and that kind of goes into the management a little bit, but, you know, training, we stress horses by training them, traveling, showing, changes in the herd, you know, the wind blew differently. You know, sometimes you look at horses weird and they stress out. I own one of those. You know, so there's really a lot of stuff we do with horses contributes to their stress. And then, you know, the question marks, to an extent, especially when you're talking about glandular ulcers, so ulcers in that darker pink part of the stomach, we don't entirely know. Yeah, all these factors play a role, but the pathophysiology of some of these ulcers is still currently unknown. And when we get to treatment, it makes it a little bit hard to treat, because if you don't entirely understand what causes them, it makes it harder to treat them effectively. And we have treatments, but they could be better if we one day will understand these ulcers a little bit better. So symptoms of ulcers, you guys are probably all really familiar with this part. Weight loss, reduced appetite, poor hair coat, recurrent colic, especially your low-grade colic, that they're not throwing themselves on the ground, but they're definitely uncomfortable. You give them a little medication, they get better, and they do it again, you know, a few days later. But the biggest two symptoms we see, attitude changes and poor performance. So these are the horses that are mad about working, or even if they're not mad about it, they don't go forward. They're not jumping as well. They give you attitude when you're tacking them up. Some people think about girthiness. Studies don't really show that correlates well to ulcers, but in my interpretation of that, because that is reported, is that these horses are anticipating pain. So this bad attitude that we're seeing, they know that when that saddle gets put on, they're gonna have to work and it's gonna hurt, that their stomach's gonna hurt. And so this girthiness is more of a anticipation type behavior than a true direct, the girth is causing me pain, or, you know, triggering these ulcers. And the big takeaway is that these signs are not specific. There is not really a great symptom that you can be like, oh yeah, that horse for sure has ulcers. I mean, there are times that there's enough symptoms that kind of go together that make you think like, yeah, that's high on my list. But I tell you what, we spell horses that have clean stomachs, that have these symptoms. They are not specific. So it makes it a little bit of a challenge, you know, when you're looking at trying to diagnose these horses and trying to treat them appropriately. Any questions so far? So, diagnosing. Really, the best way is to go in with a camera and look. So, gastroscopy. You know, people will try, oh, I'll try him on this med or this supplement. Yeah, it's not as specific, not as concrete of a diagnosis as going in and actually looking. I listed a couple other things, a sucralfate trial. That's something I will do sometimes with horses. Sucralfate is a medication we'll get to a little bit more when we talk about treating, but acts a little bit as a Band-Aid, makes them feel better. And so what I'll do is, you know, put them on that for a couple days, see if we see any positive changes. Do we have any improvement in their attitude, their behavior, their performance? And if so, okay, yeah, we're gonna scope and see where these ulcers are, how bad they are, you know, get some more information. There's a fecal blood test that's on the market that some people talk about. I'm not a fan. It's not really been proven to be very effective at diagnosing ulcers. It's not reliable. So I don't recommend it. Just not a good option. Really, gastroscopy is the way to go. I mean, you can't you can't beat actually looking and actually being able to see. And like I talked about with these symptoms, you can't diagnose these horses by symptoms alone. You know, a lot of horses with poor performance, bad behavior, that could also be explained by, you know, poor tack fit. You know, if the saddle doesn't fit right, you'll have horses that have very similar signs. So, you know, we have suspicion based on symptoms, but it's not conclusive. So, talking more into gastric ulcers, the disease itself. So, the experts that research this, the general community, splits talking about ulcers into the essentially two halves of the stomach. So the top half of the stomach, so equine squamous gastric disease, so that's the top light pink color, the non-glandular section of the stomach, and we grade these lesions. So a grade 1, your mucosa is intact, but you have a little bit of thickening, a little bit of change. I don't know if you can appreciate, there's a little bit of yellowing here. In this one, there's some thickening down here. That's called hyperkeratosis. So indicative of a little bit of gastritis, a little bit of some mild inflammation, but not actual gastric ulcers. You don't have any true defects in the mucosa. So then moving on, grade 2, as you can imagine, a little bit worse. Now you actually have some erosion in the mucosa, but it's not too bad. It's superficial, not real deep. There's not that many of them, small lesions. Grade 3, again, just getting a little bit worse. Deeper lesions, bigger lesions. A lot of times you'll start to see some of the thickening. In this picture, you get some of those thickened borders. But as you can see, worsening of your lesions. And then grade 4, these are pretty significant. You know, a lot of grade 4s have evidence of bleeding. They're pretty deep, some pretty significant erosions, and some pretty big lesions as well. What I would like to not forget to mention, part of the problem with ulcers is that severity does not directly relate to the amount of pain the horse is in. So you can have grade 2 ulcers with a pretty clinically painful horse. We've also had grade 4 ulcers with moderate clinical signs. So it is not a direct correlation. And so you can't say, oh, well, ulcers aren't that bad. That's probably not it. Any ulcer is worth treating in my mind, because if the horse is showing symptoms, he's telling you there's pain. Like I said, you know, we do scope some too that are negative. So there's not a direct relation, and I've been amazed at some of the really severe stomachs that we've had, that the horse really had some pretty mild signs. So you can't put more emphasis on grade 4. Yeah, from a treatment standpoint, yes, because I mean, that's some pretty significant disease. But from a behavioral standpoint, grade 2 can act just as bad as grade 4. So splitting the stomach into the two halves, then we talk about equine glandular gastric disease. And I include pyloric lesions into that as well. So that's the bottom half of the stomach. Bottom half of the stomach is a very different cell type. These cells have more protective mechanisms because they are made to essentially be in acid a lot, whereas the top half of the stomach is not supposed to be as exposed to acid. So these ulcers are different, they look different, and they respond differently to treatment as well. I will often grade these just for my own benefit as I'm tracking cases. If you look in the literature, they don't grade them. They describe them. So these are the words that are usually used to describe these lesions: fibrino-separative, or hemorrhagic, raised, flat, depressed. You can see in some of these, they're raised. They're not the flat mucosa. It's normal to have folds, so I wouldn't necessarily call that fold pathologic, but that ulcer there is. But these lesions are raised here as well. That's a raised lesion. This, it's a little bit hard to tell in the picture, but this is right below the margo plicatus. So you have your non-glandular stomach over here, and this is right kind of along that border. That's not raised, but definitely abnormal. So yeah, not always graded. I personally do just for my own. Makes life easier for me when I'm comparing cases. So just some more pictures of different ulcers, kind of the range of things that we see. Some more of these raised nodules, you know, some pretty significant ulceration through there. A comment I'd like to make too, you know, some of these raised lesions that we see in the bottom part of the stomach, they kind of essentially become little adenomas. And while we want the surface, the mucosa, to go back to normal, a lot of times you don't get rid of that raised appearance to it. You get some chronic changes there. So that's not a goal with our treatment. We want the surface mucosa to look as happy as possible, but doesn't always go totally back to normal. Any questions? I feel like I'm going kind of fast.
For like long-term chronic changes, are there like problems associated with that, with digestion later on, having like the changes in the folds and that kind of thing?
Not really. We're not really recognized. I say not really because I'm not sure if I kept this picture or not. I have seen some horses that have some really, really remarkable changes. I mean, to the point where, you know, the question is this a tumor? You know, a true pathologic tumor, or just ulcer disease. And that horse, it was not a tumor, it was ulcer disease. He lived many years. With management, he never went back to normal. And I was worried about that in him. I'm using my hands, seriously, it was this big, like by his pylorus. And I was worried about him, about it affecting his digestion, and it never seemed to. He did great. So in theory, yeah, there might be the occasion, a horse where that does become a problem, but the vast majority, no, they do okay. They do really pretty well. It's kind of amazing what horses can live with sometimes. I mean, that's just in general, outside of their stomach. So, treatment. This is the big part. We have ulcers now, what do we do about it? So, omeprazole is really the mainstay of treatment for ulcers. I'm sure you've all heard of Gastricard and UlcerGuard. The only FDA approved treatment for ulcers. And I'll get on my soapbox a little bit here. I do not like compounded generic medications of omeprazole. I don't like them, I won't use them, I won't recommend them. I think a lot of times it's a waste of money. The problem is omeprazole is a little bit of a finicky drug. It has to be absorbed in the small intestine and then absorbed systemically to work. So that being said, it needs to get to the small intestine. It needs to not be broken down by the stomach acid in order to be absorbed appropriately. And so it has to be in a carrier. You know, in people, ulcer meds, you swallow them, so you don't have to chew them, but they're enteric coated for that reason. Well, we can't really get horses to necessarily swallow a pill. So we have a paste. And the reason that Gastricard and UlcerGuard work is because they are in a formulation, they have carriers in that paste that have been shown to get it to the small intestine so it can be absorbed. These powders, other brands' paste, they don't have that carrier. So I don't, you know, maybe in some horses it might help a little bit, but you know, when you're trying to treat this disease, I want to spend my money on something I know that's going to work. And a lot of these products, there's just not enough evidence that it works just because of the way the drug works and the way the drug has to be absorbed. So what is omeprazole? It's a proton pump inhibitor. What that means is it helps change the pH of the acid in the stomach. So it raises the pH, so it's less acidic, and then it creates an environment where the ulcers can heal. None of our treatments directly heal the ulcers themselves. We're creating environments where these ulcers, essentially the body can heal itself. So changing the pH is a really important part of that. And that's what omeprazole does. That's how that drug works. So Gastriguard and Ulcerguard, they are essentially the same thing. They're labeled differently. You know, Ulcerguard is labeled so that it, as a preventative, you know, you give a quarter of a tube to your average size horse. Gastriguard, you give a full tube to your average size horse. Big part of this drug, probably the most inconvenient part of this drug, is that it has to be given on an empty stomach, and that can be a little bit of a challenge. Most of the time we recommend it's given first thing in the morning before morning feed, at least 30 minutes. So 30 to 60 minutes before they're fed. Again, because food will inhibit its ability to get to the small intestine and be absorbed appropriately. So it's really important when using this drug that it's given appropriately. There's been some solid work that shows if you give it with food, it doesn't work as well. And you know, a lot of these drugs aren't cheap, and I want to know if I'm giving a drug that it's at least going to do what it's supposed to do. So it does make it a little bit of a challenge, sometimes, especially in boarding barn situations. But you know, it's well worth it because it's just a waste of time and energy largely if you don't give it that way. So other drugs that we will often use, so sucralfate I mentioned before. It makes horses feel better a lot faster because it acts a little bit as a barrier, as a band-aid. It sticks to the ulcer and provides some protection. Also provides a little bit of increased mucosal blood flow. So, you know, when you're healing wounds, essentially, a little bit of increased blood flow is going to be helpful. So a lot of times I will use that drug in the first part of a horse's treatment because omeprazole is a little bit slow to give clinical effect. And for a lot of these horses, I want them to feel better as soon as I can. So I'll use these drugs in conjunction. That being said, again, omeprazole is a little bit of a funny drug. I don't want to give these drugs at the same time because I don't want to interfere with the absorption of omeprazole. But it is a worthwhile drug and can definitely make them feel better faster. Misoprostol, that's a prostaglandin that we use primarily for ulcers in the bottom part of the stomach. Omeprazole, you know, if I have ulcers in the top half of the stomach, in the non-glandular stomach, that's pretty reliable. I'm pretty confident, and if I give a month of omeprazole, that horse is gonna be a lot better, if not fully healed. They're gonna be a lot better. It's pretty reliable response. Ulcers in the bottom half of the stomach, not so reliable. And this is where I had mentioned before, we don't entirely know the pathophysiology of ulcers in the bottom of the stomach, so that makes treating them harder. Misoprostol, being a prostaglandin, it helps promote the normal protective mechanisms that the bottom part of the stomach has, so like things like mucus production, to help protect those cells. So what we're, again, trying to do is create a better environment for the body to heal itself. And so misoprostol can be really helpful for those ulcers in the bottom part of the stomach. There are some situations where we will use all three of these drugs at the same time, treating ulcers. There are situations where we'll only use omeprazole or we'll only use misoprostol. It's very situation dependent on kind of what my treatment course is going to be. And also ulcers in the bottom part of the stomach, again, because we don't know what causes them, we don't have as good of treatment, often it takes longer for them to heal. You know, there's a lot of research that's being done. I'm hoping that one of these days we understand a little more and we can be a little bit better about treating them and treat them in a more timely fashion. Some of these horses can get really persistent with their pyloric ulcers, and it can be a little bit frustrating, and it can take months of treatment. to get these horses healed. Hopefully not, but it happens. So this goes back to why gastroscopy is important. If you are just, okay, I think my horse has ulcers, I'm just gonna put him on some Gastrigard for a month. Clinically, he might do really well, but if he has ulcers in his pylorus, especially severe ulcers in his pylorus that are gonna take longer to heal, and you take him off of that Gastrigard in a month, you're gonna be back where you were. And you know, gastroscopy, it's a little bit annoying, if you will, because you have to fast them. It's really important that they have at least a 16-hour fast. Stomach has to be empty so we can look at it. You know, we can't see through the food. So it can be a little bit obnoxious for owners. No one likes to look at their horse that's screaming at them because they forgot dinner. And but it is really important to know what you have, so you know what you're treating and you can treat more appropriately. Yeah, there are some horses that they just have ulcers in the top half of the stomach. 30 days of Gastrigard, easy peasy. Life goes on. We talk about some, long-term maintenance. But those ulcers in the bottom half of the stomach, they get persistent, and you can waste a lot of time and energy if you don't know what you're treating. Some other drugs that you may have heard of. So H2 agonists, so drugs like cimetidine, ranitidine, famotidine. We don't use those too much anymore. Ranitidine was a decent option if Gastrigard was not possible, usually due to expense. It is no longer on the market, unfortunately, so we don't have it. Cimetidine and famotidine, they're largely a little bit underwhelming. I'll sometimes use injectable famotidine if I am seeing a colic and I'm worried that ulcers might be why they're colicking, because it's something I can give that might make them feel better faster. But in the long run, it's not going to be as good as the proton pump inhibitors at healing ulcers. I already talked about compounds, my little soapbox about why I think they're not worth time when it comes to this. My exception to that, if I've scoped any of your horses, you've probably heard me talk about a compounded injectable that's available. I do like it. It's not a perfect alternative. It's nice because you do give it once a week for the first 2 weeks, then you skip a week, and then it's every 2 weeks after that. So it's a little bit easier from not having to dose a horse every day. The downfall is some horses get some pretty significant muscle reaction to it. And their neck will swell up and they'll get sore. And it's usually transient, it's limiting, it goes away, exercise helps, but not everyone likes to see their horse with a sore neck and a big swollen neck, and so it very much can be a little bit disconcerting that way. So it's not a perfect drug, perfect medication, and it is still compounded. They have long-acting injectable versions in other countries. I really hope that one of these days we'll have an option here, because I think it'd be a nice alternative when, for management reasons, whatever, Gastrigard isn't ideal. But, it is an option. I do use it a lot, but it's certainly not ideal. Antibiotics. So you might be familiar with, in people, they sometimes treat people with ulcer disease with antibiotics. H. pylori, Helicobacter pylori, has been strongly identified as a potential cause of ulcers in people. They've looked really hard for that in horses, have not been able to find that, not been able to prove that there is any bacteria that contributes to ulcer disease in horses. It's not saying it's not. Every once in a while, if we have a really persistent case, we might try antibiotics just to try and cover our bases and do something different to try and potentiate healing. Not something I do routinely. It's a pretty rare case that I might try antibiotics on. So it's not something that we do. Not something that has been considered or been proven to be a cause of ulcers in horses. Not saying that they won't find one eventually, but right now there's no evidence to suggest that there is. Any questions on treatments? Yes.
So after you've had a vet out, you're treating for ulcers, there's a ton of supplements and products that are like on these shelves here.
I'll get.
Are there any of them? Oh, you're not.
Yeah, it might be the very next slide. So I will get to that because that is a big part about it. And you know, when we're looking at these horses, just because I treat these ulcers doesn't mean that they won't develop new ones. So once I've treated a horse and okay, we rechecked a scope and we know that their stomach is clean and that we're safe to take them off meds, okay, what do we do in the long run to try and keep from revisiting this, because that's a real thing. So I guess it's not the next slide, it's 2 slides, but we'll get there. Yeah.
Big differences in the formulas between Gastric and Ulcer.
No. 1 tube of one is the same as 1 tube of the other.
In the dosing room.
Yep. Yep. I don't know if you wanted to add anything to that. But, she was asking if there's any difference in the formulation between UlcerGuard and Gastrogard.
Just the dosage.
Yeah,
on the
yeah.
tubes labeled.
Yeah, it's the labeling. So we've fixed the ulcers. Let's try and make some changes to not have to revisit this. So things that are good and helpful for ulcer horses from a feed and management standpoint, alfalfa hay is really good for horses that are ulcer prone. That can be a little bit of a challenge to get sometimes. Hay is better than the cubes and pellets, but if you can't get the hay, the cubes and pellets are a decent option. Continuous hay. Horses are made to be eating more or less all the time. So having continuous access to forage. So we recommend a lot of the slow feeder hay nets, especially for the easy keeper types that are just going to vacuum up all their hay. You throw them 2 flakes of hay and a half hour later it's gone. Slow feeder hay nets or there's some other slow feeder devices too that can be used so that they essentially can have hay in front of them more or less all the time. Since I just said that, let me revisit the omeprazole because I told you that you want to give that on an empty stomach. So if a horse is stalled, what is generally recommended is that they get like a flake or so of night hay, at no later than 10 o'clock. Usually what happens is they finish that, they don't eat as much overnight. Even horses that are turned out don't eat as much overnight. And so by the time you get there in the morning to feed them, dose them, they have a relatively empty stomach. So that's generally how that's recommended. Now, if the horse is on night turnout, that changes things a little bit. There's been some work that's shown that horses that are turned out at night or 24/7, they don't eat much, but usually by 6 o'clock, 6 a.m. is when they start eating again. So really, if it's a turnout situation, you want to dose them at 5, which is obnoxious, but if you're trying to not change the management too much, that's what needs done, is that they need dosed early because they will naturally start eating again right around 6. But continuous hay. Low starch grains, high starch grains have been shown to potentiate ulcers. I really think as an industry, we've moved largely away from high starch grains. Most common grains these days are low starch. So really the cases where that is going to be an issue are your really upper level performance horses, your race horses, your upper level event horses. I'd say probably on average, most horses are fed a lower starch grain. But if they're not, we might discuss changing that, trying to figure out a better option. And there's so many different products on the market these days that there really is. There's an option out there for everyone that can be successful. Oil has been shown to be helpful in horses with glandular ulcer disease. Not as helpful for horses with the non-glandular disease, so the ulcers on the top half of the stomach. Not that it's bad, it's just not going to be as helpful, but it can be helpful for horses that struggle with pyloric disease or glandular ulcer disease. So, some of the challenge of that is some of these horses are easy keepers, and we need to be careful about overfeeding them. But that is a possible management strategy that can help. Yes.
What oils would you recommend in that case?
So, it doesn't, I mean, there's a lot of oils on the market. You kind of want to go a little bit more for omega-3s, oils that have omega-3s versus omega-6. So some of the research was done with corn oil. And that's a higher in omega-6 oil. So I don't really have a specific one. I often recommend canola. Horses seem to eat it pretty well. But there's the canola oils, there's rice bran oils, flaxseed oil is good, especially if your horse has skin issues. Flax is a good option. I don't have a favorite oil essentially.
And how much oil did they recommend on their studies?
It depends on the horse, really, because of the potential for overfeeding. So, on average, an eighth to a quarter of a cup can still be beneficial without overfeeding.
Yeah.
But that, there are some hard keepers that you can feed more than that too.
Okay.
So it does vary.
Okay.
So then turnout. Horses are made to be outside and moving, so the more you can train these horses out, the better. Understandably, sometimes that's not an option, but the more, you can figure that out, figure out a way to get them out and have friends. Horses are herd animals. They don't want to be by themselves. Being by themselves can add to their stress, even if it's not outward. And a lot of times horses that have the worst ulcers are the horses that internalize things. So going into stress management, so trying to figure out what bothers your horse and minimize it. So, doing different types of training to try and reduce the stress. They have also shown, going into the number of work days, horses with glandular ulcer disease are at higher risk if they work more than 5 days a week. So I will often recommend horses with pyloric lesions that you keep their work level to five days a week or less, and split up those off days so that they work a couple days, have a day off, work 2-3 days, have a day off, because that has been a significant sign, or correlation would be the better term, as far as that horses that work more than 5 days a week are at higher risk of having glandular ulcers. Yes.
Sorry, when you say work, I guess I'm like, is that riding specific work? Does that include like lunge work or ground
So
work?
training. So if you're just taking them for like a nice walk down the lane, I wouldn't probably, unless that stresses your horse out, I wouldn't count that as work. But training. So here's the ulcer supplements. There's a million out there, so many. And some are, and there's probably some great ones that I'm not even mentioning, but for simplicity, I really pick a few that I like and kind of stick with that. Part of why I have picked these supplements specifically is they have science behind them. They have studies to show that they help. A lot of supplements on the market don't. So I really try and pick things that at least have some sort of evidence that they're going to be beneficial. So I have them split up a little bit. So Protect GI, Purina Outlast, Reline, I think are all good stomach supplements. The Reline I tend to recommend a little bit more for glandular ulcer disease. I don't recommend it as much for non-glandular disease. The Purina Outlast, absolutely helpful for non-glandular disease. The nice thing about that product too, one, it's a pellet, so you just top dress your horse's feed with it. It's easy. It also comes in treats too. But you can also give it before a stressful event, like as a little bit of a snack. Just feed a cup of it an hour before you put the horse on a trailer. It's going to help buffer your horse's stomach while it's on the trailer, which we know is a stressful event for horses. So that's part of why I like that product. And they have done studies showing that it helps buffer the acid, and it does it longer than a lot of your routine supplements that are on the market. Yes?
Would Constant Comfort be comparable to
So
that?
that is supposed to be Tribute's version. I've not seen as much data. Sean, have you seen data from them?
No, it's more anecdotal.
Yeah, but that's supposed to be Tribute's version. And I do have clients that are using it.
Pretty comparable though? Like,
It's supposed to be.
Okay.
I say it's supposed to be just because I haven't actually seen the data that Purina has, but in theory, it's supposed to be comparable. The Protect GI, that works a little bit different. I think that is helpful for both non-glandular and glandular ulcer disease. Works a little bit different than those other two. That has one of the leading researchers in gastric ulcers. His name's Benjamin Sykes. He helped create this product. And so if he's one of the, one of the guys in the world that knows the most about ulcer disease, it's probably going to be a pretty good product. That one has only been on the market for what, a year? About a year, I think.
Yeah, maybe 2 at most.
Yeah. Platinum Performance GI and Succeed. I like these supplements. I tend to recommend them, and I think they're similar, so I tell people one or the other, don't do both. For overall GI health, I tend to recommend them a little bit more for colon issues, but they, in theory, can be a little bit helpful for stomachs too. Some of them are advertised as gastric supplements. Both of those, the Platinum Performance GI and the Succeed, they have glutamine in them. Glutamine's a amino acid that is important for GI health, like at a cellular level. So they kind of help from support just a healthy GI tract. But again, I think there's so many out there, and I'm not saying because I recommend these that the others are crap. There's just so many, and I'm always going to choose ones that have some scientific evidence behind them than just saying, oh, well, this one is supposed to do this, and if there's nothing to really support that it does, it's more of a gamble to me. And a lot of these supplements, it gets expensive. So if I'm spending the money, I want to know that I'm spending the money on something that's gonna help and do what it's supposed to do. Yes.
So is it a good idea with the Outlast to just have it on hand and those times you are trailering, just
Yeah.
even with a horse that may not have?
Yeah.
Okay.
Yeah, I do it with my trail horse, who actually does have ulcers, but that's another story. He lives a hard life. But I do that for him that, before I haul out for a trail ride, I give him some Outlast.
Okay.
He doesn't live on it, but yeah.
Yeah.
And some
So it's
horses,
sporadic. You can
yeah,
give it to
yeah,
them
you can.
sporadically.
Some horses, it is beneficial for them to live on, especially when they're in a management situation where you can't do as much as you want to do. The barn doesn't have as much turnout as you want, or it's springtime in Ohio and the pastures are closed because it's a disaster, and you just need to get through these next few months. Yeah, that's a good time for them to live on it because you know that they're going to be more stressed because they're not having as much turnout. So yeah, using it a little bit proactively is a good thing to do.
How far ahead did you say you recommend giving them like the Outlast before a stressful event?
30 to 60 minutes. It's probably better if you get closer to 60 minutes. Gives it just a little more time to kick in, but you can kind of sneak and get away with 32 if you're in a hurry.
Can I hear more on Succeed, your bottom one on there?
Yeah, what's specifically?
Well, someone recommended it. I was just curious, like, what opinions you had around it.
So I think it's a good project. I recommend it more often when I'm dealing with colon issues.
Okay.
I think it's a better product for that than ulcer issues. Though that being said, it has glutamine in it and that's a big component of it that supports normal GI tract function on a cellular level.
Does it help more of like the hindgut ulcers?
I think so.
Okay.
I don't know if that's my opinion. I don't know if there's,
What you've seen so far.
yeah.
Thank
But I do, and horses that have either suspected hindgut issues or like the fecal water syndrome that a lot of horses have, I'll recommend that.
Okay.
Which product was she
The
asking?
Succeed.
Succeed.
Yeah, and the Platinum Performance GI also has the glutamine. The they're not the same product, but they're similar products. So I tell people to pick one. Like, don't put them on both. That's overkill. But to pick one.
With the Succeed, there's a shelf version and there's a vet version. Which version are you talking about?
So I usually just use the shelf version. I don't routinely use the vet version.
Okay.
Maybe that's wrong, but I mean,
Well,
maybe I would get
curious
better.
Because like I said, I know
Yeah.
one you have to get from your vet and one you can buy on
Yeah.
the shelf, and I know
Yeah.
that the compounds are differently considering one has to be prescribed
Right,
by the vet.
right. And I do routinely use the shelf one or recommend the shelf one. And yeah, like I said, maybe that's wrong. Maybe I'd have better effect in certain cases if I use the vet one more. But that's, you know, another thing we have to stock, and
Because
it's
vet
more
version's a lot more and shelf
yeah,
version's free.
yeah, it does, and it's a lot more convenient for people to go get it on their own. Any other questions on treatments? This might be our last slide. Yeah, so just want to say thank you to BI for, you know, being here, sponsor, support. And any more questions, I'm happy to answer. These are my two horses doing things that gives them ulcers. They've both had ulcers. They might both currently have ulcers.
How often do you scope a horse and find perfectly good versus, yeah, we're gonna scope and you see something? Do you find good ones
I do. I'd say it's maybe 1 out of 10
that are clean?
that are clean.
Yeah, I mean, if you read the
It's-
literature, they say 60 to 80% performance horses, so that
Yeah.
doesn't include a lot of what we gastroscope.
Yeah.
But there are clean ones, and as
Yeah.
Dr. Paradine said, I think it's very imperative that, I'm Dr. Allison, by the way.
Yeah,
I'm not
sorry.
just-
He-
I work at the clinic, I'm not
he's-
just like
he's here
randomly talking.
to heckle me,
I'm not
it's
here
fine.
buying a hat.
Um,
But like, that's why it's so imperative to do the gastroscopes, because you don't know. You know, for us, we're already at a disadvantage with horses because they can't talk to us, right? This is like one of the only things that I think that we can do diagnostically where it's very straightforward and you can do it with us.
Yeah, it's clear cut.
and
They're
it's
there or they're not.
Yeah, it's not an x-ray we're trying to
Yeah.
explain to you. It's not weird blood work we're trying to interpret that you're on Google for an hour and a half trying to figure out, like, you either see them or you don't. So that's why I think it's so important to do it. The other thing is, there's a weird misconception about, I think, how much they cost to do. And because of that, I think a lot of people are hesitant to do it. Gastroscopes are, number one, you can do them on the farm. They're just sedated. It's a very straightforward procedure. You can do it in literally 5 to 7 minutes by the time the scope goes in the horse to the time it comes out. So it's not traumatic for them. But like, people think, like, I've had people come to the hospital and they're like, I just don't know if I can spend $2,000. If we did gastroscopes for $2,000, I could retire.
We
in
wouldn't
like
do very
5
many.
years. So they are not that much. I mean, I think, not getting into specifics, usually most of them are under $500 with sedation to do. So if you're willing to spend the X amount of money on GastroGuard, which it's worth the money, I mean, they put the money into it, it's worth it, but then also ancillary treatments, you know, time out of your training schedule. If that's not the problem, you've wasted money on a problem that's not there. You've wasted training time potentially. You've also still haven't figured out why your horse isn't right. So
Yeah.
don't let the cost, like I said, even if you say it's 500, like, you know, treatment can be at least 12 to 1800. So why not make sure your 12 to 1800 is going to something that's supposed to be there? It's just such a silly, you know, it's just like, if you thought your horse was lame, you thought it was navicular disease, you would go get someone work it up. You wouldn't be like, I'll just put on Butenshame shoe and I should be fine, right? It's the same thing. You want to know what's there. So this is one of those few things that we can literally sit there with you and point a finger to it, and everyone's going to understand it. So
And people who have never even seen a gastroscope before, I mean, they look like wounds, and so like one shows up on the computer screen, and people are like, "Oh, what's that?" Like, yeah, exactly. That's an ulcer, you know, because it is clear cut, and there isn't that question. And like I said too, you know, you can treat them for a month. If they have pyloric ulcer disease and they need more aggressive treatment, and you just stop after a month. Well, you haven't wasted a month, but you're not going to be where you need to be. You're going to have to keep revisiting this. And you don't know unless you look, because clinical signs for ulcers are not specific, and they're certainly not specific for the part of the stomach that is affected. Oh, something I forgot to mention, when it comes to GastroGuard, I meant to mention this when we were talking about treatments. So we used to taper omeprazole. In people especially, they've noted a rebound gastric acidosis when you stop medication. It's not quite the same in horses. They've shown that rebound acidosis lasts for maybe a day, maybe two. And the current literature actually suggests that you don't, like, especially if you're using some of these supplements that are going to help buffer, you really don't need to taper. There are some occasions I might, again, based on the individual. I used to taper a lot because that's what I thought that, you know, you had to do. And since some of that work came out, I quit tapering, and knock on wood, I've not seen a change in response in horses. Like, no one's calling me saying their horse looks terrible after a couple days off of Gastric.
Can I add something?
Sure. Oh, yeah.
Do you see more of a problem in a certain breed of horses than other horses?
So, not necessarily. What we see is different location in the ulcers. So warm bloods, we definitely see more pyloric, more glandular issues in warm bloods. Not many thoroughbreds have pyloric issues. Thoroughbreds much more likely to have non-glandular ulcers. That being said, it's not a hard and fast rule. There are lots of warm bloods that have non-glandular ulcers, and there are a handful of thoroughbreds that have pyloric ulcers. But just kind of as a generalization, there is a little bit of a difference in breeds that way. Though I can't talk maybe so much about like some other breeds as far as like your Morgans, your Arabians.
I was just wondering if the hot bloods seem to tend more toward the ulcers than their common bloods.
No. We scope a lot of warm bloods with ulcers. That being said, I'm not sure I've scoped a draft horse.
I did one.
So I can't talk about that. And I've only scoped a couple ponies. Those ponies had ulcers, but I've only scoped a few ponies. Yeah.
So if you put your horse on Succeed or some of the other supplements you know, how long do they need to be on it? Is it like the rest of
A
their
lot of
life?
horses, it's forever. Or I'll qualify that. As long as they're doing or in their current situation. Some horses, okay, they're show horses, they need to be on those meds while they're showing. They get retired and turned out and they're off to live the good life. They probably don't need them then, but they need them for that period of time. And I mean, there are some horses that are more or less retired, but they're in a boarding barn situation that is maybe not 100% ideal. Yeah, those horses should probably stay on them. And there's a little bit of individual variation. You know, I also, when I scope a horse, and again, this conversation usually happens at our clean scope. After we've treated the ulcers, we rescope them to make sure we're where we want to be. I'll make a game plan with that owner, with that individual, about moving forward best management practices for that horse. You know, a lot of show horses, we use Ulcer Guard, or we'll recommend Ulcer Guard for when they're horse showing. My dose and recommendations of that varies horse to horse. There are some horses that I also recommend horse show and misoprostol. Again, that varies dependent on the individual, their ulcers, how their course of treatment. So, you know, I make some generalized recommendations like I have just now, but that can change a lot with the individual.
I think it's important too. You know, I have some clients that think they should just do GastroGuard for the rest of the horse's life. Number one, God bless them if they have that much money. But number two, there are studies that show that the longer you on it, you get a decline in the actual efficacy of the drug. So in the best interest of the horse, I understand what they're doing. That doesn't necessarily work like that. So that's where a lot of times, like Dr. Paradine said, it changes husbandry practices. You know, other drugs that we can keep them on longer term, they're a little bit easier financially and may work better. And a lot of people, you know, if the horse is in a stable state, maybe when they know they're going to go to a show or they know they're going to travel, then they give some Ulcer Guard as kind of a preventative. That's kind of where you start using that. But like the Ulcer or the Gastro Guard for the rest of their life is just, number one, I think it's cost prohibitive, but number two, that's not also necessarily a good idea.
Yeah, and they've shown in human med too that long-term use of omeprazole, those types of drugs, can inhibit calcium absorption and lead to potential for fractures. I don't think that has been proven in horses, but there's certainly a concern, especially considering the fact that most of the time in horses a fracture is a death sentence. So it's not something we want them to live on if at all possible. And you know, I've got some horses that show pretty heavily, you know, go to Florida in the winter, they don't have a big break, but when they do have a break, even if it's just for a few weeks, we take them off the meds, so that, because we know they're going to have to go back on to keep doing their job, but any chance we can that they have a little downtime, we'll take them off meds, so that when we're not running into some of these long-term issues. Yes.
I know we're not talking about hind gut, but is there anything that we, like symptom-wise, that we need to do more to that versus the stomach?
Yeah, so I think the hindgut stuff in general is a much bigger question mark, because we don't have good diagnostics for it. So there's a lot of talk about it, and the answer is we truly don't know. I think it's probably over-suspected. I think there's probably not as much true hindgut issues as gastric issues, as stomach issues. I don't have any data to prove that, but my suspicion is, people worry about hindgut stuff probably a lot more than they need to. But usually we see, I worry about it in horses with chronic colic, with chronic loose stool, or the fecal water syndrome horses where their manure, they'll have normal formed manure, but they have a lot of water around it. And that's a syndrome because there's a lot of different causes and a lot of different potential management changes for those horses. What works for one might not work for another. But those are cases that I'm gonna worry. We don't necessarily recognize as much the performance issues. In theory, yeah, if they're uncomfortable there, they could still have performance issues. I think largely the incidence is probably not nearly as great as horses with stomach ulcers. But because it's a big question mark, it's a big unknown, there's a lot we don't know about it and a lot we just can't diagnose about it. So it's just it's always a question and always a concern. I don't know if that helped at all, but
Okay, you're up.
yeah.
So like, I have a Cushing's horse. Have you seen that that's like a common thing with the stress of Cushing's to have ulcers?
No, but I think that those horses don't heal as well.
Okay.
So a lot of times they need treated longer.
And like, she's on percent once a day, every day. So like, is there anything in the treatment or the supplements that like I should stay away from since she's already on a daily medication?
In general, no. I would not dose the Percend at the same time as omeprazole. The hard part about Percend is sometimes it can affect their appetite. And so the question is the Percend causing the issue in their appetite? Is the ulcer causing the issues in the appetite? And that can be hard to sort out. But in general, there shouldn't be any significant like drug interactions or things like that. And if your horse is well controlled, the Percend is keeping her numbers in check and clinically she looks good, I don't worry about them as much because the drug is doing the Percend is doing what it's supposed to. And so it's really more of with some of this stuff, I worry if they're an easy keeper. Free choice hay is not always the answer, but just trying to figure out for the individual the best case. But in general, I think it's just more an issue of they just don't heal as well.
In a hypothetical situation, you have a horse that's happy, no symptoms, just going about. There's really no need to call and say, scope them, right? Because there's nothing being presented.
Correct. What's really,
let's say they do have an ulcer, but you're not seeing anything. Is there any long-term damage, like 15 years down, because they're not giving you any?
In theory, yes, because anytime you have chronic wounds, you get some chronic changing to the cell types in the cell population. You can get anywhere just from scarring, scar tissue from chronic wounds to, this is not common, but chronic wounds, there's potential for cell mutation in it turning into a cancerous type process. Super rare. But hypothetically, what's really interesting is our practice did sort of an in-house with ourselves gastroscope wet lab a couple weeks ago, and we brought in just our own horses to just practice some things. And I would say I don't think any of the horses we scoped were clinical. You could maybe argue, because 2 of mine were there, that maybe they had some very subtle signs, but every single horse we scoped had ulcers. and 6 of the horses we scoped live outside 24/7 and don't do much. They, I mean, and they, not a single horse was clean.
Were there any symptoms in those horses at all?
No. That being said, some of them aren't handled daily, so there could be some, you know, if we tried to ride them, there could be some symptoms, but they're retired and they're just hanging out. So, but they all eat well. Most of them are fat. You know, they're clinically looking at them. You don't think anything was wrong with them. So it's interesting, really, just showing how many horses have ulcers, and again, that there's not a direct relation to ulcer severity or ulcer presence in pain. Not all ulcers hurt. But if they are clinical for it, then absolutely, you know, anytime I scope a horse, even if it is, you know, a grade 2, just a couple little superficial and multifocal, yeah, it's still worthy of treatment. Because if the horse is saying that something is bothering them, it's worthy of treatment.
I think that's an important point too about them being subclinical, because we'll see horses that, like, maybe for its performance issue, and we talk about ulcers, and then people go, well, I did U7, just to say, because it comes to mind, I did U7 and I fixed the ulcers. You don't know if you did that. You may have palatably made the horse feel better, but that's not how you cure ulcers. Like I said, the eye spent probably billions of dollars figuring out that Miprazole can do this, so that's why we use it. So what you did is you probably made the horse feel better, but you didn't fix them.
Yeah.
So to me, unless you can show me before and after pictures, you can't tell me you fixed them.
Yeah,
So,
and a lot of these supplements, I mean, that goes to, they help, and they can help clinically, and I think they're very helpful for long-term management. But if you have an ulcer there, not a single one of those supplements is going to fix the ulcer. You have to change the environment, really medically, usually medically, to get them to
A
heal.
lot of the supplements are buffering the stomach acid for a short period, so your horse, you know, you might give Purina Outlast 30 minutes before you get on your horse, and your horse is clinically better, like you feel like moving better, extending, what have you, but that's short-lived and the ulcers aren't healed.
Yeah.
Like, so the big thing with Gastric is, like Dr. Paradine said, it has to make it to the small intestine, absorb through the bloodstream in order to shut down the proton pumps to produce less acid so that the ulcer can heal. And I was also gonna add, if your veterinarian, Cleveland Equine Dr. Allison, scope your horse, like we're so confident that Gastric works, it comes with a customer satisfaction guarantee. So if Dr. Paradine scopes your horse, 28 days later we re-scope, and she's not happy, we're not moving forward and where the horse should be, and you know, she's not healing, like the company helps to support that. So, I mean, most expensive medication is one that doesn't work. So if you're dumping $300 a month into your horse on all these GI supplements, and most of them don't have research behind them, you're better off putting the money into a scope with your doc to actually figure out what's going on with the animal. And like my horse had no signs other than struggling to get a lead change from right to left. Like she was just guarded. It was just a lead change. And my vet, before I worked for companies, thought we should scope, and we did, and she was a grade 4. So it can be something very minor where you're just like, we're just not quite getting there. Why?
Long term, like you said, you had old horses that had, that pasture horses that had it.
Mm-hmm.
So you treat it, we get rid of the ulcers. In 6 months, a year, are we gonna have ulcers again?
Well, and that's the whole
I mean, is
problem.
this, yeah, how do you continually?
And that's where the management changes that I talk about, and I think supplements play a role for your long-term, essentially prevention of the ulcers. You're not going to fix your ulcers, but once we fix them, how can we keep them from coming back or minimize the chance that they're going to come back, knowing that we're still taking our horses to horse shows and still doing stressful things with them.
And non-stressful, like
Well,
or
yeah,
pasture
yeah,
horses.
right. So that's where we have, and I really try and, you know, talk with the individual, because everyone's program is different. you know, everyone's either boarding or housing situation is different, what you feed is different, you know, your show schedule is different. You know, I talked about the one horse that shows a lot that, you know, essentially has to stay on omeprazole long term, but every chance we get, we take him off of it. Because there's a lot of variability there, and so we'll discuss all these changes and what can we do to maximize these changes for the individual and minimize the chance that you're going to revisit. And some horses do. Some horses, because one, there's so much we don't know about ulcers yet, that we do everything we can, but we know we're still probably, you know, falling short. And a lot of the research is going to continue to help that, but you know, it's not 100%. But that's exactly the goal is, okay, we fixed these, we know they can come back. What can we do to prevent that?
Did you ever hear about feeding them before they perform?
You know what, I did.
So one comment I just asked Dr. Perrin about is I can't remember who it was, some university, they put a scope in a horse and they put it on a treadmill and they let it jog. And to watch basically the stomach acid sloshing. So remember, it's like running with a fishbowl, right? Empty fishbowl with water in it, it's everywhere, right? What they did is then they fed the horse and they redid it, and it significantly reduced the splashing, for lack of a funny medical term, all over the stomach. So that's why a lot of times you'll hear people say feed the horse before they perform. Doesn't mean a whole bag of hay, throw them a flake of alfalfa, do things like that. Because just having, especially for, again, the squamous or non-glandular ulcers up high, which are getting burnt by that acid, if they've gotten something to stop the splashing, basically, that helps. So again, it's a lot of these husbandry things that maybe you don't think about right away that are actually kind of important and do play a big role in things.
To that point, what about like grain? Because I guess when I was growing up, it was like don't grain before you ride.
Hay, not grain.
Yeah. He's talking
roughage. Hay, whatever you
alfalfa
have.
cubes.
Yeah, something like that. Just trust me, when we go and scope these horses and someone forgot to close the door and they ate, or someone forgot to take the hay out in the morning, it does not take that much food for us to get in there, and it just looks like a giant loaf of bread that immediately means your exam is over.
Yeah.
So, and that's why we make you fast them, because I'm telling you, there's nothing worse than us getting there, sedating the horse, setting up this equipment. You're already kind of mentally exhausted because you had to fast your horse, and then we get in there and there's food, and then we go make another appointment.
Yeah.
I mean, that's all you can do. We can't make that just disappear in a couple minutes. So it makes a big difference having just a little bit of food in there. Again, not a whole hay bag, just a flake or something. Makes a big difference.
How much digestion? How long do they digest?
I mean, usually do it like, there's still a lot in there, but you do like 30 to 60 minutes usually, because again, you want their mouth clean, so when you go put the bit in their mouth and get them tacked up, you don't want hay all over in their mane and everything else. Barrel people probably don't care, but like the show horses, poor God, don't have something in their rein, so.
Well, and I
yeah.
think that's important too for racehorses, because a lot of time with racehorses, they would intentionally withhold feed before they race. And I don't work on the track, so I can't comment to, you know, husbandry practices right now on the racetrack. But I know that was a thing, and really that's not ideal. You want to at least let them eat a little something to prevent that acid sloshing.
Yeah, they're not going to cramp and drown in the swimming pool if it's not more than 45 minutes. Like, it's not that type of thing like us.
Yeah.
So the aloe vera, does that do anything to help?
I don't think so. Yeah. You can have your opinion. My opinion is aloe vera is a waste of time.
I think if you think it works, that's great, but you gotta do the other stuff too.
Yeah. Behind you, and then I'll get to you.
What about a good deworming program? Because like bots that adhere to the size.
So it's rare for bots to be so numerous that they create an issue. We do occasionally see bots on a gastroscope. Usually it's a few. So if you are routinely deworming, usually recommend an ivermectin or moxidectin in the fall. As long as you're getting that every year in the fall, I don't worry too much about them. But that just goes to, in general, even if your horse routinely has a negative fecal egg count, you still want to deworm at least once a year. For things that don't show up on fecal egg counts, like bots, tapeworms, those kind of things. So yeah, but it takes a lot of bots to really contribute to the problem. That being said, yeah, if we see them on gastroscope, we'll say, oh, hey, give your horse a dose of ivermectin. Oh wait, you were next, and then you.
I'm curious about information. Like, when you have ulcers and you clear them up, manage to clear them up, is there information on how long it takes for ulcers to develop and come back, or?
It's pretty variable. I mean, there's studies out there, but, and part of the problem too is horse studies aren't ideal because they don't usually have big numbers. But I think it varies a lot with different populations. And there's a lot of factors that go into them developing ulcers in general. So if you have a horse that's sick and not eating and getting a lot of bute because it has a lot of fevers, they're probably going to develop them sooner than a horse that is, you know, trailing out twice a month for a lesson, you know, that kind of thing. So I don't have a great answer for that, but it's variable. Yeah. Yes.
You made that comment about racehorses and how they think they weigh power before.
Yeah.
I work on the track. That is a common.
That is still a common practice.
I don't myself. My horses, I leave them happy until 9 hours before.
Yeah. And that's.
We start getting them ready.
Yep.
There are a lot of people who still.
We'll spread the word.
Yeah.
Yeah.
There are still a lot of people who 4 hours before they race, they pull water.
Yeah, they kind of go with the Lasix rule. When they get Lasix, they pull everything, and really they should wait. Yeah, yeah, yeah. Thanks.
And would that be a good time to give a little bit of the Outlast
Yeah.
before?
Yep.
So, okay.
Yep.
Any before any stressful?
Yeah.
Well, remember too, the products that have Outlast in it don't have, it's not the same concentration of Outlast per scoop. They're good products when they put that in there, yeah.
Yeah, so like Altium and Strategy.
Yeah, there's one more.
You want it.
Yeah. There are some grains that have Outlast in them. The problem, and those are good products, but the problem with those products is you have to feed a certain quantity of the grain to get enough Outlast, you know, the appropriate dose of Outlast. So if your horse needs more grain, that's fine. That's a great, easy product. You can't feed it as a snack then.
Right.
But for just day-to-day maintenance type things, those products are great. But if your horse doesn't need a lot of grain, I recommend just buying the Outlast separate and top dressing what you feed them with.
Which product earlier you mentioned the Tribute had?
It's Constant Comfort. Yeah, Constant Comfort.
They have
a block and then they have a pellet too, I think.
They have a bag of it, yeah.
Yeah. Yeah.
I've always been told that like a cup of Outlast is more harmful. Is it pointless? Does it do anything if you give them more?
It's probably just a little bit wasteful though. That cup of Outlast is directed at like your average 1,000-pound horse. So if you have a really big horse, you probably should give it a little bit more. If you have a pony, then it's just wasteful.
It's not harmful.
No, it's, yeah, you're not gonna poison them by feeding too much. Yes?
Do you do Outlast every day or just prior to working?
Depends on the horse. There are numerous occasions that I recommend it every day, that the horse just live on it. There are certain occasions that it's a less stressed individual. I just recommend it either before they work, or if even their work isn't that hard, I just recommend it before they get on a trailer.
I have a gypsy, and you're not supposed to feed him that much. And he's a ferocious eater. And so he goes for periods where he's not eating.
Yeah.
And we give him Outlast daily, 6 of them. Is that okay?
Yeah, it's okay to give daily. With him, I would really look into the slow feeder options.
We do that.
Yeah.
We have that, and he still eats.
Yeah.
He's found a way to polish it off very quickly.
Well, then you have some horses that figure out how to tear their slow feeder hay net. So then they make a hole, and it's no longer slow feeder. Yeah. So there's other, the hay nets are convenient, they're easy, they're cheap. There are other devices that are slow feeder that are harder for them to destroy. They're more expensive. I forget do you know the name of the buckets, those tall buckets? I forget what they're called. Porta grazers, yes.
There's also ones that look like a pyramid with the top cut off.
Yeah.
I don't remember
Yeah.
the name. I've also
Yeah,
had people double up the hay nets.
Yeah.
Which is kind of a pain to put the hay into, but I've had them double it up, so then
So it's
adds
an
an extra.
even slower.
So they can ruin
again,
twice
if
as many
they-
of your hay nets.
Yeah. So some of those for the horses that destroy their hay nets, the portagrazers, those type of things are sometimes better for them because it's harder for them to destroy.
If you buy those, please measure your horse's feet.
Yes. She has a gypsy, I think it'll be okay.
You'll be okay. We've had a couple of occasions where horses put their feet into the portagrazer through the hole.
And then it gets stuck because they have small feet.
And that's a disaster, as you can imagine, with basically a giant trash can sized thing on their foot. So
Yeah.
check that, please, if you do
So
that. They are
if
great products.
If you have a pony or a horse with small feet, maybe not the right choice. But a gypsy, you'd be fine.
Can those roll around the stall? Is that what they do?
They'll
with
kick them around,
They
yeah.
can. I've had people though, like chain them to the walls, if you will, so they don't have to deal with that.
I've seen people use them in pastures too,
Yep.
in turnout. They're pretty hardy.
I think rolling around would be slow them down a little.
Yeah, having to chase it.
Get some exercise in while they're
Yeah, or
eating.
those hay balls.
Yeah.
They're they're kind of a pain to fill, but they can be helpful in slowing them down because those two will roll around and you'll have to chase them. And I'm sure Big D's has them. Yeah, you can go look for them. They're sort of ball shaped, but with a bunch of little holes in them.
Yeah, we have
with a screw top and stuff the hay in. And like I said, it's kind of obnoxious to use sometimes, but it entertains the horse for a while. 'Cause it's harder for them to get out, and they kick it around, so they do have to chase it. Yeah.
Changing direction, have you noticed a difference in the horses that you scope per discipline?
I'm not sure I understand
Like
what.
a Western pleasure horse, to
Oh, like
jumping
the
horse,
type
to a
of
barrel horse,
ulcers?
What discipline?
They all
Some
have
that are
ulcers.
more prone than others?
I can't say I have. I'd say just as many barrel horses have ulcers as dressage horses, as hunter horses. I can't say I've noticed a big. Yes, one of those. Yep.
With little ones too.
Yeah, those can be helpful and also too, if you have a horse that has to spend more time in a stall, that'll help entertain them too. Other questions?
I have one here.
Oh, yes.
The Ulcer Guard costs a buttload more now. I was looking at alternative brands, and there's one called Abler, A-B-L-E-R, and it was like
Not
a UK
proven.
brand. It's not proven. Okay.
So I have clients that use it. Part of the problem too is the clients that use it, I don't usually get to scope those horses.
Okay.
So I don't get to really get a good feel on how well it works. I don't like the people will call them the pop rocks. I don't like that version because it's meant to be given largely with feed. You don't want to give them meprazole with feed. And also, if they chew them, then it's no longer enteric coated,
Right.
and so it's not
I was
going to
looking
work.
at their paste version, because it was about $10-ish.
If people really want to use that product, I tell them to use the paste, not the little granules.
Okay.
And still make sure you give it on an empty stomach. That being said, it's not proven, so I make no guarantees or it doesn't have the evidence behind it. So I'd probably put it a hair above like your compounded stuff, but not far.
Okay, thank you.
And that's why it's also crucial that we rescope these horses typically too, again, which I know Dr. Paradine said, but to make sure it's working. Regardless of what you end up choosing, make sure you rescope it to make sure it's working. We unfortunately do lose a small amount of rechecks to people that just assume once they start treating they're fine, and that may not be the case. So that recheck is also very important to make sure you're on the right track.
Especially if you have glandular ulcers. Because those are such a wild card on how they respond to treatment. You cannot make any sort of assumption on, oh yeah, if I treat for a month or I treat for 6 weeks, it's gonna be gone. Hopefully, not always. And there are some with pyloric lesions, specifically glandular lesions, I can usually heal pretty well. Some pyloric lesions that get very persistent. To the point where we make it better and we make management changes and more or less, we never get it perfectly healed. It would be great if, you know, for some of these horses, if I could scope them once every 6 weeks indefinitely, that would be great. That's asking a lot of people, you know, and I understand that, you know, from a theory standpoint, then we can keep track of things, but, you know, some of them we get to a point where we've made it a lot better. It's not perfect. We've made it a lot better. We're gonna make these changes. We're gonna make a plan and see how the horse does. So there are horses that do need multiple recheck scopes because they're not responding appropriately, and that's what, I mean, that's the value in the recheck scope too, is you don't know who's gonna do that. You know, I've been surprised on both ends. Ones that I thought for sure were gonna take longer, recheck them and it looks beautiful. Fantastic, great, let's make a plan, move on with life. And then ones that I didn't think would be too bad, and here we are a few months later still working on it. So, you know, that's the value in the recheck scope. You don't know who's gonna respond appropriately. Anyone?